Thank you, Mr. Chair, and a warm good afternoon to everyone. I should be okay. Oh, all right, so this afternoon, in my presentation, I will seek to accomplish 3 objectives. 1, I'm going to provide you an overview of the present COVID-19 status. And then secondly, I'm going to provide you an overview of the St. Kitts and Nevis National COVID-19 Vaccination Deployment and Implementation Plan. And then thirdly, I'm going to just add some more information regarding the COVID-19 vaccine. And so, ladies and gentlemen, at present, over 111.4 million persons have been confirmed with this disease globally. Over 2.5 million persons have died. And so this is based on the World Health Organization's COVID-19 dashboard. In the United States of America, over 28 million persons have been confirmed with COVID-19. And guess what? The death toll has passed 500,000. Within the CARICOM member states, over 106,000 persons have been confirmed, and collectively over 1,870 deaths have been reported. In the wider Caribbean region, the number of confirmed cases have exceeded 500,000, and the death toll in the region, in the Caribbean region that is, has exceeded 7,500. Now, what's happening in the Eastern Caribbean states? In Barbados, over 2,772 persons have been diagnosed with COVID-19, and the number of deaths, 31. In St. Lucia, 3,135. The death toll as a result of COVID, 32. In St. Vincent and the Grenadines, 1,505 persons diagnosed, 6 deaths. Antigua and Barbuda, 614 confirmed cases, 14 deaths. And then you can look at the other islands. Now, within the Federation of St. Kitts and Nevis, Mr. Samuel said we had 41 confirmed cases. But ladies and gentlemen, 40 of these cases have recovered. And so at present, we only have 1 active case. That individual remains in isolation, stable, and is being monitored. So, in terms of providing you an overview of our national COVID-19 vaccination plan, I'm going to describe how we are seeking to access enough vaccines to vaccinate our population. I'm going to describe distribution, and we are going to look at acceptance. Now, on February the 11th, the Federation would have received a generous gift from Dominica. We received 2,000 doses of the AstraZeneca Oxford vaccine. In terms of the COVAX facility, you are well aware that we have signed on to this global mechanism through which we hope to procure over 21,600 doses of the AstraZeneca Oxford vaccine. The specific date when we will be receiving same, we are still not absolutely sure. We are awaiting that bit of information. Now, the Federation is also seeking to access COVID-19 vaccines through at least 2 other mechanisms. Please note, access to the COVID-19 vaccine is crucial to curbing the spread of COVID-19 infections. In terms of distribution, most of our vaccines nationally are stored at our central medical stores located at the JNF General Hospital. And so in that unit, we are expanding our storage capacity. So we are procuring enough refrigerators to make sure that we have adequate storage capabilities there. And I must say the same for Alexandra Hospital in Nevis. And so the plan is vaccines will be transferred from these central points to the health centers around both islands. 11 health centers, St. Kitts, 6 health centers in Nevis. And so, ladies and gentlemen, the health centers are the designated COVID-19 vaccination sites. And so yesterday, we started our program at the Newtown Health Center. And so for this week, the vaccines will be administered in 7 of the 17 health centers, 4 in St. Kitts, 3 in Nevis. And so the 4 in St. Kitts, Newtown Health Center, Bastia Health Center, Sandy Point, and Tabernacle. In Nevis, Charlestown Health Center, Gingerland Health Center, and Combermere Health Center. By next week, the additional 10 health centers will come on board. And so, ladies and gentlemen, if you have decided that you are ready to take the AstraZeneca Oxford vaccine, all you have to do is go to the nearest health center and make an appointment, or you can call 311, and then within 24 to 48 hours, you will receive a call back with your date and time for your appointment to receive your vaccine. Now, in terms of prioritization, as I said before, we've received only 2,000 doses for the Federation, and so we have to prioritize. And so we are rolling out our program in 3 stages. In stage 1, there are at least 4 priority groups of persons that we will be targeting. We'll be targeting healthcare workers who are at high to very high risk of exposure to the COVID-19 virus. And these include all specialists, internists, doctors and nurses working on the COVID wards in St. Kitts and Nevis, those working in the operating theater, those working in the intensive care unit, accident and emergency, all private practitioners. They are operating on the front line. We also will be targeting COVID-19 testers, meaning the public health team who move around to all the hotels and quarantine sites to take samples. They are on the front line. This group also includes health center nurse managers and personnel working on our ambulances. We are also going to target the frontline workers working along the corridor of containment. And these include port health workers, immigration, customs workers, persons working in terms of ground and sea transportation. So that includes our taxi drivers and those on our ferries and sea taxis. Hotel workers are on the front line, those working at the front desk, security, lobby, housekeeping, food and beverage. We will also be targeting the executive arm of government and essential workers outside of the health sector, and these include police and defense force, Coast Guard, fire and rescue. We are also targeting older adults, persons between 60 to 80 years of age with multimorbidity, meaning more than 2 or more chronic diseases. And these illnesses can include diabetes, respiratory conditions like emphysema and asthma, renal disease, and autoimmune conditions. During stage 2, we will be targeting the following priority groups: healthcare workers who are at moderate to high risk of exposure to the virus. These are the healthcare workers working on the other wards, the medical ward, surgical ward, maternity, pediatrics, OBGYN, even the psychiatry unit. Staff in nursing homes and in home care services, and other staff members working in our hospitals, including our lab staff, pharmacy staff, staff in the X-ray department, and mental health, the treatment center. We are also targeting older adults with 1 or less chronic illnesses, meaning persons between 60 to 80 who are diagnosed with chronic illnesses and who are free from chronic illnesses, but just by age alone puts you at risk for moderate to severe disease of COVID-19. Please note that age 80 is not a cut point. In other words, persons 80 years and over can be vaccinated. However, it's out of an abundance of precaution that we are asking such individuals to be evaluated by their physicians and then have their primary care physician make a recommendation regarding their suitability for receiving the vaccine. In stage 2, we will be targeting persons who are in the middle age group, meaning those under 60 with chronic diseases. And then we will also target the socioeconomic groups, including low-income migrant settlements in St. Kitts and Nevis, disadvantaged persons registered in the Social Security benefit systems, persons with disabilities, persons in low-income groups, hard-to-reach populations, and persons with mental health conditions. In stage 3 or phase 3 of our rollout, we will be targeting all the staff members working in the Ministry of Education, those in the education sector, from the early childhood level up to the tertiary institution. In this stage, we will be targeting essential workers outside of the health sector, which includes police, defense force, municipal services like other civil servants, persons working in agriculture, food industry, ground and sea transportation. And then the social employment groups, and then the healthcare workers who are at the back end, meaning those that are not on the front line. And then everybody else in society falls into the third stage. So this would include young adults and middle-aged adults who are healthy without any chronic diseases. Now, we will be utilizing an appointment system. And as I said before, if you have decided that you are interested in receiving the vaccine, you just need to make an appointment. That's easy. Make contact with your nearest health center or call 311 and you will be given an appointment. You will receive your first dose and then you will be given a 10-week appointment to return for your second dose. When you receive your first dose, you are going to get or receive a vaccination record card indicating the date and all the particulars of the first dose. And then the same thing will happen when you receive your second dose, and upon receiving your second dose, your card will be stamped, and then it will be official. Now, the Ministry of Health, we are in the process of developing a database, a registry of persons to be vaccinated, and we are also going to develop a database whereby we will be capturing data from vaccine safety surveillance. So today already, I would have made a call to most of the 70 individuals who we would have vaccinated yesterday. And I'm going to share some of the information I would have gleaned between this morning and present. In terms of vaccine acceptance, the Ministry of Health, we have developed a very comprehensive communication strategy and plan whereby we will be educating the general public, providing you with all the pertinent information regarding the vaccine that we will be offering. We'll be using traditional media, radio, television, and digital media. And so the information is well packaged and will be disseminated using WhatsApp, Facebook, Instagram, TikTok, you name it. And then, please note, stakeholder meetings. And so we are going to be hosting meetings similar to this. And so we are asking our key stakeholders to reach out to the Ministry of Health, our communications arm, meaning the Health Promotion Unit, through 311. So you just have to make a call to 311 and your presentation or your stakeholder meeting will be planned and organized. Ladies and gentlemen, the goal is for everyone to be able to easily get a COVID-19 vaccine. People most at risk will be prioritized. However, while we work towards rolling out a safe and effective vaccine fairly, we must continue the essential public health actions to suppress transmission and reduce mortality. And these include active surveillance. And so the Ministry of Health, we are actively seeking out persons who present with flu-like symptoms, and we are testing them. And we continue to explain to the public why we must continue the prevention and control measures. Now a little bit more about the AstraZeneca Oxford vaccine, because Dr. Wilkinson would have explained quite a bit. This vaccine it's a biological preparation, and it's made from the actual adenovirus, not the coronavirus, an adenovirus that's attenuated or altered. It was, taken from the chimpanzee. It was altered, and so this biological preparation is injected into you. You are given a 0.5 ml intramuscular injection, your left or your right arm. And yesterday, most persons who received this vaccine, they were asked to remain at the health center seated for at least 15 minutes afterwards, such that they can be monitored for any side effects, untoward side effects. Please note that this vaccine was achieved WHO emergency use listing on February the 15th. So it has been approved. Dr. Wilkinson would have walked you through the efficacy. So the efficacy against symptomatic COVID-19 from this vaccine ranges between 70 to 90%. You would have heard, or you know by now, that persons 18 to 80 years, that's the target group that we are catering to. So these are the persons that we are targeting to vaccinate. And also persons in this age group with chronic conditions. Now, in terms of those of you who are considering this vaccine, please note, if perchance you are experiencing a fever, or you are, sick, have the cold, and you are having a fever, you really should postpone your vaccination date until you've gotten over your fever. It is currently recommended that the same products be used for both doses. So for example, if yesterday you received the AstraZeneca Oxford vaccine, you will be told to come back in 10 weeks for your second dose. So let's say you travel to Miami and your appointment for the second dose is upon you. You cannot really go and get the Pfizer, BioNTech, or Moderna. It has to be the AstraZeneca Oxford. So you should receive 2 doses. Your first and second dose should be the AstraZeneca Oxford vaccine. Now, the available scientific data on the AstraZeneca Oxford vaccination of pregnant women is really insufficient to assess vaccine-associated risks in pregnancy. And so we are advising our pregnant females not to take the vaccine at this time. Now, vaccine efficacy is expected to be similar in lactating women as in older adults. It's unknown if this vaccine is excreted in human milk. As the vaccine is a non-replicating vaccine, it is unlikely to pose a risk to breastfeeding children. And so in other words, if you are breastfeeding, it seems relatively safe for you to accept this vaccine. Now, based on the data and the science, these are the common or the most common post-vaccine symptoms to date. So persons who receive this vaccine may complain of pain, tenderness at the injection site, general feeling of being unwell, feeling feverish, having a headache, joint or muscle pain, and probably a loss or reduction in appetite. Now, yesterday, as I said before, about 70 persons received this vaccine at the Newtown Health Center. And so when I woke up this morning, I started making calls to persons who would have received the same. Quite a bit of persons said, "I'm fine. Did you really give me something yesterday?" Others complained of tenderness or pain at the injection site. Some said they felt cold last night. I think about 2 or 3 persons complained of experiencing chills. About 4 or 5 said, "Hey, I had a mild fever, but I took 2 paracetamol tablets and I was fine." Some complained of a little feeling of fatigue or malaise this morning. Some said, "I just have some body aches and pains." One particular person said, "I'm experiencing mild headache." And I think most or all the persons who were vaccinated yesterday, they all came out or went to work this morning. So that just gives you an overview of the post-vaccination symptoms being experienced by our own people who were vaccinated yesterday. Now this slide, you must be fed up of seeing this slide, but I have to show it because we must continue our prevention measures of wearing our face mask, maintaining hand hygiene, and making sure we are, as we are, appropriately distanced from each other when in an enclosed space, and avoiding crowds as much as we possibly can. Ladies and gentlemen, we must continue these measures until we would have achieved a herd immunity threshold. If you don't remember anything else, this is the takeaway slide. Which will you choose? That's what it's come down to. As individuals, what would you choose? Are you going to choose the virus, or are you going to choose to take the vaccine? And in our case, the AstraZeneca Oxford vaccine. Well, the science tells us over 111.4 million persons have been diagnosed with this disease, and over 2.5 persons have already died. The science tells us that over 173 million persons have already received this vaccine, this particular one, the AstraZeneca Oxford vaccine, without significant side effects and 0 proven vaccine-related deaths. Ladies and gentlemen, I, Hazel Loretta Laws, will make a personal decision to take this vaccine. I haven't taken it as yet. I have an appointment next week, Wednesday, the 3rd of March, when the EPI manager will give me my jab. It's an international recommendation that when you are vaccinating essential workers, it's recommended that you not vaccinate everybody all at once. You must stagger the vaccination dates. And so last week, Dr. Cameron Wilkinson and I, we had a discussion from last week when we discussed, hey, who would go first? So he opted to go first. He's not afraid of needles, so he's front in line, all right? And so I will follow shortly with my vaccine. And so yes, I will choose the Oxford AstraZeneca vaccine. Ladies and gentlemen, don't hesitate, vaccinate. A vaccination ensures a healthy nation. If you choose to be vaccinated, you're not only protecting yourself, you're protecting your family, your loved ones, you're protecting your community, and by extension, our federation. Thank you.